Hi, Lydia. Thank you for your informative discussion post this week. I also did my discussion on Indigenous Americans. Like you, I stated in my post about the difficulties in attaining education, the high school dropout rates, and high unemployment rates unfortunately faced by many Indigenous Americans. I was also alarmed by how many Indigenous Americans face poverty. However, I did not discuss in my post how twice as many Indigenous Americans compared to people who are Euro American or white do not have proper access to sufficient or nutritional food. I was further unfamiliar with historical trauma theory, so I investigated your article, Sotero 2006. It is interesting how Sotero suggests that long-term past trauma that has occurred to groups like Indigenous Americans who have experienced oppression or marginalization can continue to experience the psychological effects of the trauma 7 generations later. I personally find this fact astonishing. I feel it is similar to how my article, Jean et al. 2023, suggests a keeping radical healing in mind therapeutic approach, which is a strength-based theory, culturally competent approach. This approach focuses not just on Indigenous Americans' mental health symptoms of anxiety, depression, and PTSD, but also on how racial trauma has impacted their life, the way they navigate it, and what they have gone through. I also like how your article and the framework for historical trauma theory partly focuses on the psychosocial stressors that create susceptibility to disease and act as a direct pathogen affecting biological systems in the body. I found this reassuring as my article further mentioned how racial trauma is not an official mental health diagnosis. The medical world has previously focused on the biological causes, not the social correlations of mental health disorders. I agree that both theories can help us better understand Indigenous Americans for who they are and how their past trauma has and still deeply impacts their life and their mental health. I appreciate how you discuss stigma and shame being a potential barrier to counseling for Indigenous Americans. I did not discuss this in my original post, but I agree that it is important to recognize how they view seeking help for mental health as a sign of weakness. You are also right about the unfortunate lack of culturally competent counselors or people who are aware of and understand Indigenous American culture and the trauma that they have and continue to face. You bring up another excellent point about language barriers and how that it can be difficult to navigate when Indigenous Americans often do not speak fluent English like their counselor. I appreciate your mitigation strategies. It is important to complete multicultural competence training. Using a translator can further help with language barriers. However, it is important we keep in mind to not make the person feel excluded or like you are talking over them to the translator. It is important to still maintain appropriate boundaries and still speak directly to them, not about them in front of them. They must feel comfortable, respected, and included in their session, or they will likely not continue treatment. Lastly, I really like your idea for outreach and education, as it is important to reach out, reduce stigma, and make Indigenous Americans more aware of and more comfortable with seeking needed help. It is important to make mental health care accessible and encourage more Native American counselors. Great post this week. Have a great rest of your weekend.